So today I'm going to describe the four key elements of writing a successful introduction section using this phase 2 study in metastatic colorectal cancer as an example. So the introduction or background section of a clinical research paper tells the story behind why a clinical trial investigation or a particular analysis was performed. Although there are exceptions, there are essentially four elements of a successful introduction section that should be touched upon when telling the story behind your study. Before we get into it, consider how long your introduction section will be. Aim for 1 page of single spaced text or two pages of double spaced. It's normal to write more than this on your first draft, but you can edit it down in later drafts. So an introduction section is generally about one column, a column and a third in a printed page on your journal. So using this introduction section as an example, let's have a look at the different elements for writing it. So first, what we want to do, we want to set the scene. So what is the current situation in relation to disease or health outcome your paper is investigating? A typical approach, as the authors have done here, is to opening your introduction section is to state how common the disease or health condition you are investigating is. This is done by reporting the prevalence or incidence globally or by a particular geographic location. So prevalence is a measure of the frequency of disease or health condition in a population at a particular point in time. So prevalent cases are all individuals living with an outcome of interest within a specified time frame, regardless of when that person was diagnosed. Whereas incidence is a measure of a number of newly diagnosed cases within a particular time period. Both incidence and prevalence are important to study to estimate the risk and burden of a disease in the community. We can see here the authors open up by saying the second most common cause of cancer-related deaths in the US is metastatic colorectal cancer. So in this paper, these authors cite this reference one, they cite the World Health Organization's Global Cancer Observatory chart for the USA. This is a website that's very helpful when writing an oncology paper. So let's have a quick look at the source and see how this information was derived. The authors state in their first sentence, when they're setting the scene, they state, as the second most common cause of cancer-related death in the United States, metastatic colorectal cancer is a prevalent and lethal disease. So let's just have a quick look at the citation. This is the Global Cancer Observatory from the International Agency for Research on Cancer, and they have the date that they access this information from. So a quick search online will direct you to the website where you can find this information. Let's just have a look at the chart itself. So this is from 2022, in particular to the USA. And the authors said, remember they said, as the second most common cause of cancer-related death. So let's see where we can find that information. So on this second page here, we have incidence, mortality, and prevalence by cancer site. We look down until we find the cancer type we're interested in. Here's colorectum, and we can see it ranks number 2. So this is where the authors likely infer this information in their first statement regarding setting the scene on. So do please consider accessing this site when reporting the prevalence or incidence data for your particular cancer that you are reporting in your paper. There's a wealth of knowledge here, and I do recommend checking it out. Although not done here, a brief description of the disease or health outcome of interest and its symptoms can be included to set the scene at this point in the introduction. As the authors have done here, It's also quite typical to refer to the current treatment landscape. This can be framed in the context of a brief history of drug development for the disease or health outcome your paper is investigating. This is what the authors have done here. We saw a rapid expansion of the drug armatorium for MCRC around the turn of the century. Referring to the armatorium, defined as a collection of equipment, methods, or pharmaceuticals used in a professional practice available to physicians, is not an uncommon term to use in an introduction or discussion section. Use it sparingly though. I recommend no more than twice in your paper. So there's a couple of drugs here the authors have described with this MAB suffix. These are typically monoclonal antibodies. So remember, drug names are not just random names. There's a whole naming system behind them, especially monoclonal antibodies. If people are interested learning more about this, please leave a note in the comments. So now that we've set the scene, we've described the prevalence of the drug, a little bit of information on the treatment landscape. So now we need a segue into our next section of our paper where we now describe the issue. So once the scene is set, this is where the next section is where we provide some background on how the problem that will be addressed in your paper, what the problem is. So this is in the green therapy here, so green text here. So the authors state, as we await novel therapies to target MCRC in patients who do not harbour such characteristics. So they've mentioned here that certain genetic characteristics may impact some of these treatments that they refer to. They say strategies to optimize the therapies we already have may offer benefits in survival over our current standards. So this is the segue to the next section. Now we're going to describe the issue. So as the authors kind of mention in their segue, despite the availability of effective treatments for a particular disease or health outcome, there's often an issue pertaining to these current treatments that prevents every patient responding effectively to treatment. So this can be due to a wide variety of reasons: prior treatment history, patient's age, certain comorbidities, how advanced the disease is, and in this case here, genetic factors. So you can see that some setup or background on the issue is necessary. So the authors state here a potential strategy for improving outcomes with current treatments is increasing the dose of chemotherapy. Irinotecan with 5-fluorouracil, this is common chemotherapy, is one equally effective chemotherapy doublets for MCRC. So when paired with this monoclonal antibody or another type of therapy, it represents a standard of care for first-line MCRC. They state this is the issue, so they're setting up the background to it. So though in practice, irinotecan dosing is not typically genetically driven, common polymorphisms on this gene have been described to affect metabolism of irinotecan through issues with the metabolite, so the metabolism of a component of irinotecan. So this genotype here, they're saying this genotype is associated with affecting the efficacy of this treatment, and individuals with this genotype are associated with decreased metabolism, leading to increased exposure due to this other genetic marker. So this is providing more background on the issue. So as a result, carriers of this type of polymorphism have higher rates of neutropenia. The package insert for irinotecan states that individuals with this particular genotype, they have a risk for severe neutropenia, and they recommend considering initial dose reduction for these patients. So this is where we remember to, when we're describing the issue, we need to include some references to support our description. Referring to the package insert is a great idea. There's a wealth of information about a drug In these package inserts are summary of patient characteristic booklets, as they're sometimes referred to, and they'll often include reference to the pivotal studies of the drug. So ensure to read it and refer to it. So now that we have done our second element of our introduction, we've described the issue. Now we want to address the third component of our introduction section. This is justifying how your study will address the issue. So this is where you kind of sell the story, on where you can provide some background on the treatment or drug your study is investigating. So what have been the results of related studies assessing the same or similar treatment? Were there any shortcomings of these? For example, with respect to safety, efficacy, route of administration, and that your study addresses? Was there another study that investigated the issue using the same treatment you are assessing in a population that was not extensively reported, and for example in certain patient subgroups? Does your drug build on the mechanism of action or a treatment algorithm of similar drugs by addressing any previously identified efficacy or safety concerns? Or is the route of administration different versus similar treatments? So always remember to include appropriate references. And whatever the rationale is, it's important to state or to convince your reader on the merits of your study hypothesis. So what the authors have done here, they've given some examples of some phase 1 and other studies where what you're addressing in this particular study, where it was a secondary endpoint. So they're building on previous studies and have included a segue at the end. So here we see here at the end, higher doses of irinotecan, when guided by the genotype, have been associated with longer survival when survival is a secondary endpoint. And more recently, multiple studies have been performed suggesting increased efficacy using this particular genotype-guided dosing strategy. So what is being performed in this particular study, it isn't the first time it's been done. It's been touched on in other studies, so we are building on some previous research for this particular study. So now that we've justified how our study will address the issue, in the purple highlight in the end, the fourth element of our introduction is to describe your study. So essentially, we want to state how theoretically and or practically your study will investigate the issue that's been described above. So this is often where you would introduce your study hypothesis and describe how it was practically investigated by briefly describing design of your trial or analysis. The description of the trial design will be later expanded upon in the method, so we just want to have a brief description of it here. So we can see here in the last sentence or so, we designed this multi-center, single-arm phase 2 trial using a genotype-driven dosing strategy to determine if administering higher doses of irinotecan in this chemotherapy regimen to these particular genotype harboring patients would prolong progression-free survival compared to with historical progression-free survival. And this is in patients receiving first-line therapy. So we've nicely summed up what the trial is actually doing here, and with some rationale kind of behind this as a segue at the start of this. So we've gone through the 4 elements required for telling the story behind your clinical trial or analysis. Number 1, we set the scene. 2, we describe the issue that needs to be addressed. 3, justify how your study can address the issue. And finally, briefly, number 4, describe your study hypothesis and our study design. So depending on the type of trial, whether it be a phase 1, 2, 3, or 4, or type of analysis your study is reporting, there can be some deviation from this sort of format. Moreover, the introduction sections for literature reviews and meta-analysis have their own format too, but broadly, the 4 elements for structure in an introduction section described here are generally applied. If you would like to hear more about developing introductions for different types of paper, or you would like to see a video on a particular topic, please mention this in the comments and hit the subscribe button to hear more about future videos in manuscript development and medical writing.